I'm Rich Andreski, Bureau Chief for Public Transportation at the Connecticut Department of Transportation. And I'd like to welcome you to Along the Lines, a podcast series where we'll explore current issues and ideas on Connecticut's public transportation system. Rich Andreski here. I'm pleased to introduce the first episode of our new podcast, Along the Lines. In this inaugural episode, we sat down with Garrett Eucalitto from the Connecticut Department of Transportation and Melissa Kaplan-Macey from the Regional Plan Association. We discussed what's trending for public transportation in a COVID world and what it means for our transit riders. We are excited for you to listen in on our conversation. Thank you for joining us. This is our first podcast, and we're really excited to try something new here at the Connecticut DOT, and really pleased to have our guest with us this morning. Just a little bit of background. This morning we're all here gathered in New Haven in the what some may know as the Metro North Rail Yard. We're in this long conference room. It looks like the table in Bruce Wayne and Batman, where our deputy commissioners at the other end of the table, and we're keeping socially distant. We are in the middle of a public health emergency. And although the sun is shining and it's 70 degrees out, it's pretty clear that these aren't normal times. And so this is something we hope will shed some light on what's happening behind the scenes. Public transportation is such an essential service. In some ways, it's much like the utilities. We turn our faucets on and we turn our lights on at home, and we expect them to be there when we need them. And public transportation is no different. Plays a critical role. And so this morning we're going to have a conversation we hope you'll find interesting and enlightening. And so I'm just going to have my guests say a few words about themselves before we jump into the conversation.
Thanks, Rich. I'm Garrett Eucalitto. I'm the Deputy Commissioner at the Department of Transportation here in Connecticut. Work with Rich on a lot of the public transportation programs, as well as our Policy and Planning Bureau and Finance and Administration Bureau. So kind of a 35,000-foot level view of what's happening with transportation in Connecticut. So glad to be a part of this first podcast.
And I'm Melissa Kaplan-Macey. Rich already introduced me. Thank you for asking me to join you here today. I'm excited to be part of this conversation. Regional Plan Association is a research, planning, policy advocacy organization, and we look at the whole tri-state region, and transportation is one of our biggest issues that we address. And we've been doing regional planning for almost 100 years, and we've really never faced anything quite like where we are today. So excited to be able to explore that and talk about it with all of you today. Thanks for asking me to join you.
Melissa, thank you. We're really pleased to have you here. Okay, so let's get into it. This morning, we're going to be talking a little bit about what we're seeing on the public transportation network as a result of this COVID-19 pandemic. But let's do a little bit of table setting first. Public transportation in Connecticut serves so many people from so many backgrounds in so many communities from every part of the state. Before COVID, public transportation was moving about 270,000 people a day on our bus and rail system, moving people to jobs, moving people to medical appointments, educational opportunities, and recreation. Public transportation has always been there, and it's been an essential service. For those who rely on it, it's been essential to the economy. But now with COVID-19, we're seeing significant declines in ridership. At the low point, in the March-April 2020 timeframe, we saw ridership decline as much as 95% on the railroad. And on the bus network, we saw declines of 55 to 60%. And those declines were extraordinary. In my career in this business, we've seen nothing like it. And there is a question about when ridership will come back. In the last couple of months, we're here in July 2020, and we're seeing ridership climbing back very tentatively. On the rail side, we're seeing ridership declines now of only 80 to 85%. On the bus system, we're seeing declines of only 35 to 40%. So ridership is coming back, but it's still a long way away from normal. So the question I'm going to pose to my guests this morning is a provocative question. is public transportation dead? And I'd like to just open that up. It is a scary idea, but let's get into it and talk a little bit about that.
I'll take a first pass at that. I mean, I think the obvious answer is no. We're in a crisis moment that will last, longer than a moment. It may last months. It could last longer than that. We hope not. But I think the important point is that, like you said, Rich, public transportation is critical infrastructure. It's been here. It's been the backbone of our economy, and it will continue to be. And it's really important. I think one of the most critical things that we continue to maintain it and invest in it, because we can't allow it to fall apart. And we're in such a crisis moment in terms of the revenue to keep things just moving. But we can't let it fail. It's really, I think, just kind of talk about the different pieces of the system. We know that our road networks were overtaxed before COVID. The congestion in Connecticut, the pollution resulting from that congestion is not sustainable. So the idea that transit might be dead and everyone is going to be in their cars from a gridlock standpoint is untenable. And the reality and the fact is that so many people in our state rely on public transportation to get around. Without public transportation, we can't function. And I think, one of the things that we knew, but we really saw and are continuing to see through the crisis is the essential workers that have kept the economy moving while, white collar workers have been able to stay home and work from home. Those are the people that rely most heavily on public transportation. And so now more than ever, we need to be investing, even though we don't have the resource. And, I'm sure you can speak to the details of, how this has affected your budget and the ability to fund the system. But, now more than ever, we need to be investing in our system.
Melissa, you raise an excellent point. And our listeners may not know this, but half of all our public transportation rides in the state occur on the bus system. Those riders, we tend to hear a lot about the railroad, but the bus system is the workhorse of the public transportation network, has a far greater reach. So I'm curious, Garrett, your thoughts on where the trends are going.
Yeah, I mean, I want to go back to the question of, is public transportation dead? And I guess in answering that, I hope not, and it can't be dead, because for me, when I think about transportation in Connecticut, I don't want to be in a situation where owning an automobile is the price of entry into our economy. I think our goal should be to aim for a place in a state where you do not need to own a vehicle in order to get access to medical care, to jobs, to education. So that should be our ultimate goal as a state. So for us in Connecticut, ensuring that we have a robust public transportation system is critically important to me. Melissa brought up a great point about prior to the pandemic, congestion in Connecticut on our roadways was awful, right? I mean, it's one of the most congested areas. And so that's where public transportation has been an important point for us to try and address that. If people stay off of public transportation in perpetuity and switch to the roadways, right now, if you look at our dashboard that we created at the Department of Transportation for road volumes and traffic on our roadways, we're almost back up. We're only a few percentage points below where we were pre-pandemic. So if we're already back up to pre-pandemic traffic levels, plus we put people who are currently teleworking back onto the roadways instead of public transportation, I don't know how our system can accommodate that without serious economic impacts. So, for me, public transportation can't be dead. I don't think it's dead. I think we are seeing that on our bus system, where we are moving. We used the phrase during the peak of the pandemic, "heroes moving heroes," right? We had the transit workers who I viewed as heroes every day, going to work, continuing to run all of our service, moving our essential workers to get to work at the hospitals, to get to work at the grocery stores, to get to work at all of the public service places they need to be. So we need to ensure that we continue to provide that service that is necessary to continue all of the functions our society needs to see. So, that's my hope for where public transport is going and where I think we need to be.
So any good organization needs to listen to its customers. And Garrett, you're certainly a big fan of data. And we can agree that data needs to be at the heart of our decision making. And one of those data points is our customers. Are we serving you? Are we doing the best that we can do to provide you with the access that you need? And so we've initiated recently a survey. The survey's gone out this week, and we're asking customers, how safe do you feel on public transportation right now? Are you using public transportation? How often are you using public transportation? And what can we do to encourage you to come back to public transportation? What stands in the way? We know there's a lot of anxiety out there about COVID-19 and whether, we've even seen companies around the country and even especially New York City say to their employees, avoid public transportation. So on the question of data and listening to our customers, what are your thoughts about ways that we can better engage our riders? And what can we do to reassure them that we in fact are listening?
I think it's safety, obviously, right? Everybody needs to feel safe. So I think, it's interesting, the conversation on masks just generally, locally, nationally, it's been this ongoing kind of conversation about whether or not they're necessary, what, does it really have an impact? And now we've really seen, I read an interesting article a couple of days ago about, our part of the country and how well we've been doing and how much adoption there has been, of masking, for example. I think just, for riders to feel safe is the baseline. If you feel safe taking public transportation, then we'll take public transportation, right? I think that's the baseline. So figuring out, that people feel assured that everyone will be wearing a mask, if they get on the train, that people, maybe won't be sitting in the middle seat for a while. I don't know, that the trains are cleaned on whatever, and the buses on a regular schedule. I think that those are really the sort of entry points for us being able to really get back to comfort on transit.
Thanks, Melissa. I think that's a great point. Safety has to be our number one priority. Now let's take a quick break, and we'll be right back.
Taking the train has never been easier. Download the CT Rail eTix app on your mobile device today. Enjoy the perks of contactless ticket purchasing to your favorite destinations along CT Rail Hartford Line, Shoreline East, and connecting New Haven Line Metro North services.
Welcome back to Along the Lines, where we're talking today about COVID-19 and its impacts on public transportation in Connecticut. The question on everyone's mind is, when do we go back to normal? And what does normal even look like?
There's pretty strong consensus we're not going back to things the way they were. And, there's a lot of things that we're learning. Like you said, there's some real bright spots. And there's, been obviously a lot of challenges and a lot of tough things here. So I think we're continuing to evolve ourselves through this. And I think, it's incredible to me actually how we know, people are very resilient, but we've really seen that through this crisis, how much we have all adapted, how we've figured out how to work, remotely for those of us who can, how the department has, really been able to make tremendous adjustments to the way that you are, running your service and protecting your drivers and passengers. I think we're figuring out as we go, and there really is no direct kind of, I think any of us would be kind of disingenuous with ourselves if we could say, well, it's 6 months, it's 12 months, it's 18 months. I mean, I think, the hope is that we will get there sooner rather than later. And I think it really is dependent on our ability to adjust and to do, whatever we need to do to keep ourselves healthy and safe. And so that we can, get back to participating with each other the way we did before. But I do think we'll be wearing masks for a long time. We won't be shaking hands. We'll be, a lot more careful, maybe for I hate to say years, but, things will have to kind of just see how this plays out. Obviously, it'll depend a lot on what happens, scientifically, medically with the vaccine or whatever else. But I think that, I've seen tremendous shifts, at least in the past, I'd say, 4 to 6 weeks. And, the fact that we're able to be here today, with protocols in place that we feel safe being able to do this podcast in person and that we're all being very careful and mindful. and protecting ourselves, but also, getting back to a new normal. So this sort of feels to me today like a little bit more of a new normal, and just the ability to, like you said, get out and we're doing outdoor dining, I think, really well in Connecticut, which is great. And, obviously that we'll see where things go when the weather changes and we can't do so much outdoors. That's really helped us along towards what feels like something of a new normal for the summer. So I think I don't have, there's no answer there, but I think that we'll continue to adjust, and I think we will find solutions that are tenable, that get us, working and living and being productive. And I think we're already getting there. I can see that, happening slowly, but surely.
Melissa, your comments are spot on in my view. We tend to not the we in this room, but the collective we, right? There's can be some negativity about just about everything, right? There's sort of a potentially a negative spin, but when you think about the extraordinary response of our riders, the willingness to wear masks, the patience that folks have shown in terms of getting around in these really confusing and difficult times, everyone's sort of come together on this, and that it's really I think that's we've seen that here in Connecticut especially, and I think that gives me hope. It gives me hope that we're going to come out of this okay. We're gonna figure it out. We're going to keep working at it. We are all around this table, committed to a mission of public service. That's what we do. We believe in what we do. We believe in the importance of what we do, and how it affects very, very directly the lives of so many people. So Garrett, we at the DOT are dependent on revenue both from our fare payers and from the state taxpayers at large. And so what do you see as sort of navigating this COVID-19 emergency? What do you see as sort of the things that we should be watching for, and what can we do to make sure we come out of this in a strong, at least an equally strong, if not stronger position?
Yeah, I think when it comes to, public transportation everywhere in this country is, supported by all users as well as all citizens. And it's similar with our road system. Our road system is subsidized by all citizens of the state, whether you use that road or not. We are lucky right now that Congress has been able to provide us with funding through the CARES Act. FTA funding has come through. It's supporting all of our transit districts in the state, many of which are small, don't have a substantial margin. It's almost like a small business. Their margin is pretty thin there. So this has kept them going. It supported our rail systems with the exception of the Hartford line, which is kind of an outlier there. But we're working on that. The fact that the state of Connecticut, unified command structure underneath the governor has stood up. They have put in place a system to provide PPE for our drivers.
So PPE is personal protective equipment, masks and gloves?
Yeah. So the fact that the state has been able to help provide those masks to all of the transit districts in the state has really been a great help. So this is going to allow us to continue, but we can't stop planning for the future. Transportation, we continue to move. Our planning process continues to move. The budget process is going to continue to move. And, we are going to have to monitor those revenues really carefully. But what's the new normal, right? That's going to come into play. We have so many people out there who are prognosticating on where that new normal is going to be. And so for us to make a decision now to stop a certain program or stop a certain service, I think would be preemptive. Or, it's too early to do that. In my mind, I look to one of my personal heroes is Stephanie Pollock up in Massachusetts, the secretary at the Massachusetts DOT. And her approach, she has this no regret strategy. And in what she's always said in the past is pre-pandemic, what's the smart thing to do when you're uncertain about the future? And the smart thing to do is to run great service. And I think that's what we've been doing. We have not cut back on service levels on our bus system. We've continued to run full service because we have that support available today. We need to support those individuals reliant on it. And it provides that comfort that service is there. If tomorrow we have a vaccine and people are ready to jump back on, it's there for them. On the rail side, we did reduce service, but we still have service running. We still provide that service for individuals. So we're running great service all across the board. For me, that's what we should be continuing to do, but we need to always be looking at the 5 different roads that are diverging ahead with different budget scenarios that I worry about every night. But, I think we're taking the smart approach right now.
And Garrett, I'm particularly proud of that. We were among a very few transit systems nationally that were able to continue to provide full weekday service on our bus routes. If you looked around the country, there was significant reductions in service, and we did not see the ridership declines that some systems saw on bus. And we were able, with the help of our fantastic frontline workforce, both the mechanics that put the buses on the road and the drivers in that driver's seat, that they've been able to keep the service going throughout. So even at the darkest days in late March and early April, we were providing that full service. And there's another reason for it too, right, Garrett, which is social distancing. Although ridership did decline, we needed that capacity to give people the elbow room that they wanted and deserved. So it's public transportation. If you're in the pro camp and you understand public transportation, you understand that it is like every other service, a subsidized service. That's almost a universal truth, not just in the United States, but in many countries around the world. And the reason governments, state governments, and federal governments around the world do it is because it is so important. It's important to the lives of individuals. It's important to the economy.
Okay, so Rich, I hope you don't mind. I actually have a question for you. So I've been thinking about, on your question about growth and where we should grow the system, back to the earlier part of our conversation when you had asked about, what's it going to take for people to get back on the system. And to me, was the obvious answer was safety and people just feeling safe and comfortable. And I was curious, what DOT's plans are right now and over the next, few months to on that issue of safety and just comfort for riders and what the plans are. I'm curious.
Yeah, Melissa, thank you for the question. Safety is always on our minds, right? We need to give the public and our frontline team the confidence that it's safe to come back, and ride, not just for those non-discretionary essential trips that we were promoting, but also for everyday purposes. So we've done a number of things at the DOT with our service providers to make sure we keep people safe. The first and foremost are the obvious ones. We've been early in purchasing bulk quantities of masks to make sure every frontline team member has a mask. Gloves are also available to those that need or want them. We've worked with our bus service providers to procure bus barriers, driver barriers. And those barriers are on many of our buses already, but will be on all buses by the end of the year. And those barriers are clear glass partitions between the driver and the general compartment of the bus. So, and we've also gone to rear door boarding. So where buses have 2 doors, you'll see that the drivers are only opening that rear door for boarding. We've also been able, with the support of the Federal CARES Act funding and state support, we've been able to suspend fare collection at the fare box. And the fare boxes are located near that front door, so the public doesn't have to go up to the front door to deposit their fare, although we do encourage people to buy their fares when they can through our mobile app technology. Also importantly, and this is also something very basic, but it's important and essential, and that is the cleaning of our buses and trains. Every vehicle in our system goes through at least a once-a-day rigorous cleaning. That rigorous cleaning includes sanitizing all the high-touch surfaces with a mister or a bleach water solution that's applied to high-touch surfaces where individuals are touching doorknobs or seat backs. And on the bus system, we instituted a couple of months ago a twice daily cleaning. And so midday, those buses are pulled off the road into the bus garages and cleaned a second time. All of these strategies have helped to sort of keep exposure down on the buses. And we think a combination of those mask wearing, social distancing, and extraordinary cleaning has significantly reduced the probability that you would be exposed to the coronavirus while riding transit. We are going to keep vigilance. We're going to make sure that we keep doing that as long as necessary until this is behind us. But in addition to some of those tactics, I've been working with Garrett, and Garrett's got several initiatives that he's been able to implement over and above some of those more basic strategies. So Garrett, you want to talk about that?
Sure. Yeah. So, we've been working really closely with the state government structure that's in charge of responding to any emergency. In this case, it's called a unified command structure, and working really closely with the leadership there to stay in close contact with them, ensure that we're able to acquire the masks and the gloves and the cleaning supplies that we need as an agency and our transit districts need in order to continue operating. And what we also did was work with them to ensure that our transit workers we're able to take advantage of the rapid testing site that was open for a couple months. That provided a level of confidence that during the peak of this outbreak in Connecticut, if there was a fear they were exposed, they could come down and be tested, priority testing, treated just like law enforcement or other essential workers or healthcare workers, because they were out there working while the rest of us were in quarantine. So to ensure that they were treated equally as an essential worker, able to get testing through that state structure was really important to us. So,
and I want to give a little plug too for some of our partnerships. That one is we reached out to Yale University and said, "Would you be interested in working with the Connecticut DOT on investigating whether we can improve our ventilation systems on our vehicles, on our rail cars?" So we have this summer, there's a research program with Yale to look at whether we can increase the external air intake into the rail cars, whether that'll have a positive, beneficial impact. Can we treat the air in the ventilation system with UV light? So we're looking at different ideas and options here. There's a lot of research happening right now all around the country and the world, but we've got this fantastic university right here in our own backyard, and they've been really gracious and helpful about partnering with us. So we're also hoping to deploy any recommendations, not only on the existing fleet, but our listeners might know about our new rail cars. And so there's an opportunity to make some design modifications to the new rail cars we're purchasing. New rail cars, that sounds like a great topic for a future episode of this podcast. So at this point, it looks like we're out of time. Melissa and Garrett, thanks for being here. This has been fun. I really had a good time. Hopefully we can do it again soon. Take care. Thanks for listening to this episode of Along the Lines. This is your host, Rich Andreski. If you've enjoyed this podcast, please remember to subscribe and share.